Hello, my name is Brooke Johnson. I will be doing my speech over breast cancer and signs, symptoms, and all of the above. So I'm going to start off with saying in the U.S. approximately 1 in every 8 women is likely to develop breast cancer. To see a rough estimate of what percentages looks like, this is a number it would translate to in this class. It's on the American Cancer Society published in 2018. Now look at the numbers on a larger scale. In this room, almost everyone knows of a person who is suffering from breast cancer, be it a family or a friend. The statistics we are drawing are not meant to install fear, but to help you in understanding how important it is to know breast cancer and how awareness can save one's life. You have thoughts on how this presentation is not related to you, but I want to assure you that this is not the case. Today, I will inform you about signs to look out for, diagnosis, and treatment of breast cancer. I am sure most of you have heard at least one thing. That is a sign of breast cancer, but I want to add on into what you already know. When a diagnosis of breast cancer is done early, it increases the chances of successful treatment, which was studied on the Breast Cancer Now, published in 2019. As such, it is important to have a regular breast checks by your general physician in a case that you notice a change, one being a lump in your armpit, upper chest, and or the breast. The lump may be felt but cannot be seen. Number 2 thing would be skin changes such as dimpling or puckering. Number 3 would be changing the breast color, the way the breast may be inflamed or a red appearance. And number 4 being an unusual discharge oozing off of your nipple. Number 5 being changes in the shape or the size of the breast. Also going on, having discovered some of the most common signs, we will now discuss how one can be diagnosed with breast cancer and the different technologies that exist in the diagnosis of the disease. Pretty much to diagnose breast cancer, we need to identify whether one has breast cancer. Doctors use additional tests. In many instances, one may be referred to as a breast specialist, as they have a deeper knowledge of breast problems. To clearly understand the condition, several technologies are used to identify the underlying problem. One being breast ultrasound, to get detailed pictures of the inside areas of the breast. A machine that utilizes waves is used. This information can be found for disease control and prevention, published in 2018. Diagnostic mammogram, if you approach a doctor with an abnormality in your breast, a screening mammogram is used to provide a detailed x-ray of your breast, also found on the Center for Disease Control and Prevention, published in 2018. Number 3 would be a biopsy. When the biopsy is done on a patient, fluid or tissue from the breast are removed and examined under a microscope to observe any abnormalities of the cells, which can also be found on the Center for Disease Control and Prevention, published in 2018. Magnetic resonance imaging. This involves the use of magnets that are interconnected to a PC to perform a body scan. The scan gives detailed pictures of the breast area, which can also be found on the Center for Disease Control and Prevention, published in 2018. After having undergone the diagnosis process, there can only be 2 outcomes, positive or negative. If negative, it means you are free from cancer.